Good morning, and thank you for joining us for the latest digital briefing in our series focused on how coronavirus is upending our society. My name is Akunna Cook, and I'm a senior fellow here at Third Way. I'm really excited about today's program on COVID-19 and racial health disparities. Many of you may know that Third Way just recently put out a report on how COVID-19 is decimating diverse communities, large and small, and it's available on our website at thirdway.org. Before we begin, I want to just remind the audience that you can submit questions at any time during this event using the Q&A feature. And we also invite you all to join us tomorrow for a conversation with Mayor Steve Benjamin and Andre Perry of Brookings, focused on the role of mayors in COVID response, which we'll probably touch on a bit today. I'm very pleased to have with us Congresswoman Lisa Blunt Rochester of Delaware. Congresswoman Blunt Rochester has been a leader on the issue of healthcare disparities and health equities, and has worked with Third Way on a number of bills focused on lowering the cost of healthcare and collecting demographic data related to COVID-19. She serves as Assistant Whip for the House leadership, sits on the Committee for Energy and Commerce, which has broad jurisdiction over healthcare, the environment, commerce, trade, energy, telecoms, manufacturing, and consumer protection. She is a former statewide health official and understands healthcare from a number of perspectives, and we are thrilled to have her with us today.
Thank you.
Thank you. Mayor Frank Scott Jr. was elected in 2008 when he became the first Black mayor elected by popular vote in Little Rock, Arkansas. He is a Little Rock native, a banker, an associate pastor, and has served his community in the past as deputy police director and director of intergovernmental affairs. He was also the state's on the state's highway commission and on the board of the Little Rock Port Authority and Big Brothers and Big Sisters of Central Arkansas. He was recently profiled in the Atlantic on his leadership on coronavirus response and navigating the city-state politics in the southern city that is grappling with the disproportionate effects on its Black residents. And so thank you for being here, Mayor Scott.
Thank you.
Dr. Garth Graham is currently the Vice President of Community Health with CVS. He is a leading authority on social determinants of health and health equity. And as the Vice President of Community Health for CVS Health, he leads the enterprise-wide social determinants of health strategy. Previously, Dr. Graham, who is a cardiologist and professor of medicine and today's expert on health, and so we're glad to have him here. He led the Office of Minority Health, and under the Obama administration, issued the federal government's first national health disparities plan. And so we are pleased to have the four of you with us today, the three of you with us today, to talk about what is a really critical issue. So we're seeing how coronavirus is having this disproportional effect on Black, Latino, and Native communities. You know, the numbers are particularly striking. And one of the things that I've noticed is that, and that we've noted in our report, is that regardless of location, so city, suburbs, small town, rural, regardless of income levels, you're seeing a disproportionate impact on people of color. And so, Congressman, I wanted to start with you and ask you, what do you think are some of the issues, some of the socioeconomic issues that are underlying these disparities, and what kind of public policy response do you think is in order right now?
Well, first of all, Akunna, thank you so much. And thank you to Third Way for having me. You are, as an organization, have done some incredible work, and I've been really fortunate to partner with you. I also am very honored to be on the panel with some esteemed panelists who also are, I know, will bring a lot to this conversation. When I saw the title of this session about COVID doesn't discriminate, but people do, it was funny because I had an immediate, like, visceral reaction, like, oh, do we want to say that? And, you know, it's funny because it reminded me of one of my favorite quotes from James Baldwin. He said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." And I think what tends to happen is on an issue like this, people either like put it in a box and say, well, if those people, whoever they are, did better with did exercise, ate better, did these certain things, they wouldn't have these underlying health conditions, which is contributing to the number of cases. And you have people who are really understand and get deep into the issue, like Dr. Graham. But I would say the majority of folks are either oblivious or they don't want to be offensive. And I feel like this is something that's why I congratulate you for the work that you're doing and for having this session, because I feel like this is something that we have to face head on. I mean, the second part of your question is like, you know, sort of what are the effects? Well, how's it manifesting itself? We see it's manifesting itself by the number of people who are contracting COVID and the number who are dying. But I think what we need to be looking at is kind of going back to some root causes and some of the root issues. And some of that is just historical. I mean, if you look at Native Americans and their relationship to this country, you look at African Americans and how we came to this country, some of these things are historical. Some happen over years of Jim Crow and other things where you get this terrorism that you feel, and it creates a stress so that no matter how much money you have, whether you're a congresswoman or not, you walk into a room and there's certain triggers that go off for you and that create things like hypertension. Where you live makes a difference. If you live near a toxic area, then you are likely to maybe get asthma. If you are in a food desert, then you might not be buying the best foods and therefore get diabetes. And so there are these structural issues that have to be dealt with in addition to how we as individuals all take care of ourselves. So, you know, I think as we get into the conversation, we'll talk about some of those specific things that on a federal level or state level or even a healthcare level that can be done. But I think it starts with, first of all, facing the issue and facing the problem, because it is manifesting itself in epic proportions right now during this pandemic.
Thank you for that. Dr. Graham, I want to turn to you just to follow up on some of what the Congresswoman just said. You know, as somebody who's led the Office of Minority Health, can you talk a little bit about some of the policies that have attempted to address these and what you think is really critical at this point in terms of how do we actually begin to address the immediate sort of fire that we're dealing with, and how do we think about the long-term structural policies that are needed at this time?
Great, and I love the way you phrase the question. Firstly, I think I want to thank the Congresswoman for her leadership. You know, the leadership of Congress throughout the years, you know, going back to Lou Stokes' days when we had minority health legislation that really changed our infrastructure, has made an impact on how long Black and brown people live in this country. So we have to recognize the various ways we can lead, certainly on the health and public health standpoint, but I think a lot of folks, including Representative Lisa Blunt Rochester, have been leading to save lives in a different context. So let me back up and just throw a couple of things out there. You know, back in 2009, when we had the H1N1 epidemic, the numbers were not much different. One of the most interesting things we saw there was the epidemic was also impacting children. So we saw in some of the CDC data, how the impact, the negative impact is having on Black and brown children. What am I saying? None of this is new. A lot of this, as Congresswoman pointed out, is recycling of perennial problems that we've seen. In 1918, when we had the flu epidemic, you know, there were interesting things that came out of that, a lot of narratives that came out. One narrative was somehow that Black people were inherently inferior, and people tried to propose that narrative at the time. And you had a lot of Black leaders in the African-American physician, nursing, and public health community at that time really pushed back on that narrative and established a new way of approaching epidemics. That gives us a kernel of what the solution must look like. And that gives us a sense of the kinds of things that we need to do in the short and the long term. And I think we can look back on the past over 100 years in terms of how communities have responded. So here's how I would encapsulate the solution, both from a kind of a legislative and a public health perspective. In 1918, we thought that there was less incidence of flu in the Black community because we weren't measuring them. In fact, we were trying to ignore communities back then. So this concept of measurement is 100 years old. We've been dealing with this thing for a long time, and still as a country are struggling with this, despite the fact that we have great public health tools that can measure what's happening in people's homes and build that back up to a national tapestry. So we have to be more proactive about the BRFSS and the CDC, how we deploy some of the measurement tools, get them back in real time, and be able to utilize that to inform policy in a very concrete way. The second thing we have to think about, and I think Congressman pointed this out, is this differential impact on social determinants. And that in the United States, where you live dictates how long you live. And so understanding the kind of legislative and public health investments that go into that, and the things that we know work. There are a lot of things that we know work, and being able to deploy that. So I would summarize by saying in the short term, I forgot to mention this emphasis on testing. Testing and data, same thing we had back in 1918, is very similar to what we're facing 100 years later, right? Lack of testing allows us to ignore a problem. Once you test it, you have to track it. Once you track it, you have to do something about it. And so the lesson to learn from 100 years ago is we have to be faster, more nimble in how we track data as it starts impact minority communities. One of the things I would say, besides minority communities being in locations that may have more, the environments may produce more of challenges in terms of dealing with the healthcare system and issues around housing and transportation, is we have to forget that we're overrepresented in essential healthcare work, in essential work, whether that be some of the essential healthcare workers who are helping hospitals stand up themselves, or people in the front lines keeping the supply chain open. So understanding how we test those individuals, bring them into the public health system, and make sure they're safe has to be part of the short-term solution. And then the longer-term solution goes towards a lot of the strategies that we've been talking about for a long time in terms of dealing with disparities in social determinants of health. So Akunna, I would summarize by saying, as my mom used to say, there's nothing new under the sun. A lot of this is kind of issues that we've seen again and again and again. It's just now amplified in the nature of this current epidemic. And there are kinds of things we know work, and it's about moving faster on those things, both in the short and the long term.
Thank you. Mayor Scott, I want to turn to you for a second because, you know, a lot of people don't realize this, or hopefully people on this call do, but somewhere around 52% of Black Americans live in the South, and particularly in the South under Republican governors. And that's come into the spotlight recently because we're seeing Republican governors respond to COVID-19 in a really political way. And in cities like yours in Little Rock, where you have substantial numbers of, you know, minority communities that are being impacted this way, can you just talk a little bit about the dynamic that you're seeing, particularly because Arkansas is at the, you know, at the bottom of a lot of metrics that matter here, whether it's the percentage that are uninsured or the percentage of folks who have access to paid sick leave, or even having not expanded Medicaid under the Affordable Care Act. So can you just talk a little bit about the dynamics you're seeing in the politics and how you're managing that, given your role?
Well, I think it's first good to understand in a current pandemic like this, healthcare was already critical, but definitely we're seeing now how much it's truly an issue that in a public policy that we all have to focus on for the long term and the foreseeable future. And once we have that understanding of what public health and healthcare overall has a disproportionate effect on Black and Brown communities, it'll help us as policy leaders to focus. So with that being said, I just want to thank yourself and the Third Way for really highlighting minority disparities, because the greater that we have an opportunity to highlight these disparities, it's the better access that we will create. So thank you so much for Third Way, and it's truly a pleasure to be with this esteemed group today. From a political perspective, I would say that Arkansas is a bit unique, mainly because we are in the Deep South, but we are a very small state. And so with me having the honor and the pleasure to be the state capital city mayor, Little Rock is a population of 200,000. We're really a microcosm of the United States. We're both rural and urban at the same time. We understand the impact of being a southern city and a southern state, and always have to navigate. So being irrespective of what political party you're part of, whether you're a Democrat or a Republican, you're not the same Republican or Democrat that you see on mainstream media. And we often have to work together and also fight the obstacles of the mainstream media and the national parties, because in a small state, your reputation and your trust and partnership and relationships truly matter. And so we do our best to navigate our national affairs with our local affairs and ultimately try to find some type of compromise with the best interests of our residents and our constituents. And so what you've been seeing right now are two local leaders, being the state capital city mayor and myself, and the governor, really try to figure out what's best for our city, what's best for our state, but also understanding both the public policy and the political realities that we face from an external standpoint.
Thank you. And so I want to just go back to policy responses. Congressman, you've been particularly focused on lowering the cost of healthcare and expanding healthcare access. And so I want to just talk a little bit about the work that you're doing and how critical it is, now, and what you see as sort of the next steps as we contemplate future COVID relief packages.
Yes, thank you so much for asking that question. And I want to echo the remarks that were made before on so many different levels, everything from the fact that in a situation like this, it can't be simply partisan. I mean, not only if you just even care about people's lives and from a moral perspective, but from a money perspective, people are looking at this and saying, hey, those essential workers not going back to work, our economy not opening up, that makes a difference to the state and local revenue. That makes a difference to, and I found one statistic I just have to share. It was in the Hill last year that said that health disparities cost the US economy some $230 billion a year in direct medical care expenditures and more than $1 trillion in indirect costs. So again, this is also an economic issue. And one of the bills that I've been working on and have been working, you guys have been a great partner on, is a bill called Cap Costs Now, which is to cap the cost of out-of-pocket expenses for individuals, because we know that if you can't afford healthcare, you don't have it. And so one of the big things that we've been looking at as part of that plan also focused on a health disparities component of it, that the data is so important. And so even as we look toward COVID and what's happening now, I think the cost cap legislation that I have, legislation to create a data warehouse to try to get this information is really important, because as Dr. Graham said, if we don't have the numbers, then you don't have to face it, going all the way back to James Baldwin. And so data collection is important. I think equity in terms of testing, treatment, and vaccines, that's also going to be very, very important. And transparency. One of the issues I didn't mention when I talked about the historical perspective is trust. We have a lack of trust as well when it comes to particularly African Americans, Native Americans, other populations, and how we've worked with the government over the years. And so we have these pieces of legislation that we're working on. But I think COVID-19 presents an opportunity for us to really rebuild some of the structures that we have. And one of the things Dr. Graham said, nothing is new under the sun. And I can say one of the things that is different about this, number one, is that real global connectivity with the economy is a little bit different now, but also representation. When I ran in 2016, Delaware had never elected a woman to Congress, and Delaware had never elected a person of color to Congress. And so that's also a facet to this. You are seeing more people with that transparency stepping up, engaging, and getting involved in the solutions. So I think that makes a big difference. But thank you for letting me plug my Cap Costs Now bill, and also the work that we're doing as it pertains to data for COVID-19. I'm also working with the Congressional Black Caucus, a small group of us, a think tank, small group that are looking at, with Robin Kelly, the head of the Brain Trust, and Jim Clyburn, who I know you've had on here, to really work with officials throughout the country to bring light to these issues. And lastly, I would just say, yesterday on a call, as you know, some of the governors have developed these compacts around the country to look at how to reopen safely. And in our area of Delaware, we are part of one. And Mikey Sherrill, the Congresswoman from New Jersey, actually started one for members of Congress so that we can mirror what our governors are doing. And it was actually Peter King from New York, who is a Republican, and I don't know if we voted alike on maybe anything, I don't know. But he was the one who brought up the issue yesterday of race and ethnicity on our call. So again, I think it's impacting all of us. And I hope that this is an opportunity to rebuild in a more equitable and smart and just way.
Yes, thank you for that. On the point of rebuilding, because I do think that the conversation is beginning now about how do we, we are now seeing COVID expose a lot of these disparities and a lot of longstanding issues that have existed in our country. And this is an opportunity for us to reimagine and rebuild, maybe even upbuild. And so what are the priorities, you think, as we think about the long-term structural change? What are some of the priorities that you would say, these are the top 2 things that we need to be thinking about as we reimagine?
Well,
you're going, is this for the mayor?
Anyway, all 3 of you, I'm gonna give all 3 of you.
One of the first things I would say, just to kind of build on Congressman as points on rebuilding, one of the things that we're working on is we're clearly on the same wavelength. We're working on in Little Rock is a Rebuild the Rock plan. Because as you shared, third way, in addition to the healthcare disparities, we're beginning to see what many of us have already knew about, which is economic disparity from unserved and underserved Black and brown communities within the financial markets, as well as with general economic development. And so as we build upon this whole concept and vision for rebuilding, we first have to reset, and then we have to restore. And as we reset and we restore, we then can rebuild. And so what that looks like is what are we going to be doing for our small businesses? What are we going to be doing for the individuals in the gig economy? While we applaud the great work that Congress has done with the CARES Act and what they're doing with the Payment Protection Program, we're starting to find out that one of the main reasons why there are a lot of small businesses that are not having access, or when they have the opportunity to get access to the PPP loan program, it's already wiped out because they were not prepared. And the reason why they were not prepared, because we as policymakers haven't really dug in on economic development from a standpoint on how do we build up small businesses, how do we build up our gig economy to understand they should have a CPA. They should ensure that we're always doing our taxes, and we should ensure that we have a controller in place. And when we have those things in place, we really can't operate from that type of standpoint. But that's not anyone's fault, but a policymaker's fault, because we have not done enough. And so when we understand that not only is it the healthcare disparities, but also the economic disparities, we understand now these are the issues that we need to do as we have an opportunity now to reset and to restore and to rebuild.
And Congresswoman, your top 2 priorities in terms of reimagining and upbuild?
I was going to defer to Dr. Graham first.
Well, thank you, Congresswoman.
Yield my time.
Well, listen, this is historic, right? So back in 1918, W.E.B. Du Bois, as I was mentioning earlier, when he saw what was happening with the flu epidemic, called on the leadership in the African-American medical and public health and nursing community to rise up, and they did. Nursing organizations formed, local hospitals banded around, and all kinds of interesting things happened. So I do think that this is a key time for us to define and stand up. So in doing that, and the Congresswoman made a very, very good point, which my mother always tells me as well too, which is, the past is the past, but we can't change that. We can't change the future. We do have a couple of key things that we've never had before. We have the kinds of things like the instrument of telemedicine, which allows us to reach into people's homes in a different way. So we have those kinds of technological tools to kind of reach people. So I would say the two things I would focus on, I would still go back to a more sophisticated data infrastructure system, because without the data, we can't track and trace. Back when we looked at the 1900 census that was showing the differences in infant mortality, that took decades to really act on. We should be able to act on data in days, when we should be able to measure, look at, see what's happening, and respond. So we do need a more sophisticated data infrastructure about how we track the impact on health disparities in various communities across the board that trickles down, I would say, from what's happening in communities, but even what's happening in homes, and being able to track that. We do have the technology to be able to track that all the way back up. So to the Congresswoman's point, I think there are a lot of new things we have, and we should utilize all of that technology appropriately. I would say the one other thing I would think about investing in if I had all the public health cares in the world is how we build a primary care infrastructure that takes into account social determinants of health. And why is that? Well, during all of this, the first thing we told everyone is call your doctor if you have symptoms. If you don't go to the emergency room, but if you have a flu and if you feel like you have the flu, you have a cough, call your doctor. How many people had a doctor to call? So understanding what the general front line of healthcare is really like, and being able to kind of put that in perspective. So I would say if I had my druthers and utilizing the time wisely, as the Congresswoman yielded to me to say, I would say improved data collection that takes into account the technologies that we have nowadays, and the improved frontline healthcare that understands both the social determinants of health, but is actually present in local communities. And I think there are a lot of examples of that with community health centers. But again, we were telling people to go to primary care doctors that they didn't have. And understand that lets you just know just how important primary care doctors are within this fight.
Okay, Akunna, I want to reclaim my time. Reclaiming my time.
Yes, ma'am.
I just wanted to add, first of all, Dr. Graham brought up a really great thing about the social determinants of health. I actually have a bill that's focused on the social determinants of health, and it's a bipartisan bill. It is currently focused on youth, but we've been having that conversation in our Energy and Commerce Health Committee. I think I've heard of hospitals that are now looking at how can they reimburse or get reimbursed for like housing. If somebody's living in a housing that's got asbestos or something in it, that's going to affect their health outcomes. So I think that flexibility is going to be really key to be able to provide a robust health system. The two things I would say are, and it kind of ties in very much to both. One of the areas I'm very focused on, I was able to start a bipartisan caucus this year, the Future of Work Caucus, and it deals with things like automation, machine learning, artificial intelligence, but also the gig economy, universal benefits. It's interesting because that vision, we as a country don't have a North Star or vision for these things that will require broadband and require the ability for people to have portable benefits. This moment creates that opportunity. For African Americans, I had research done by the Joint Center that said 6 out of 10 of the top jobs that we hold are at risk from automation. So when you start adding these things on, we either have an opportunity here or we push ourselves further back. And then the second piece for me that is a big one is accountability. One of the challenges that I've seen over the years is that, I actually got high blood pressure trying to get a minority health office in our state, like that back years ago. And what happens is a lot of times municipalities or the government, they'll have an office and they maybe do programs and things like that, but we don't have a systemic, everybody's held accountable for outcomes. So one of the other areas that Cost Now bill is about is value-based care. Not just how many procedures did you do, but did anybody get better? Quality. So to me, the second big thing for me is accountability.
Thank you. We're getting questions rolling in from the audience, and I just want to remind everybody again that you can submit questions using the Q&A feature. So one question we've gotten is, can you talk a little bit about how state legislatures or Congress, Congresswoman, anything that they're doing to address the mental health impacts the pandemic is having on communities of color?
It's interesting that you would bring that up. I just had a conversation with the head of the American Medical Association, Dr. Harris, Patrice Harris, and she specifically wants to make sure that we focus on the mental health aspect of it. You know, this is one of the areas we're seeing across the board that this pandemic is affecting what was already, for many people, dealing with their own stressors already. Is an issue that that has come up. We right now have been a part of letters to the leadership to say we need to be including that in the next CARES package. We have another package that we're working on. We are told that we're going to go back into session next week and have already begun working on the CARES package. I know the doctor, and I'm sure the mayor could attest to the fact that we're seeing, you know, just between mental health challenges, and then you think about domestic violence or child abuse, and now families are in a home where they're being told to shelter in place, and we've seen the numbers of calls go down because those children are not in a school where somebody would be able to identify these things and report them. And so the whole issue of mental health also fits into the telemedicine piece. Because we were able to put in legislation and money for telemedicine, I've had reports from counselors that are now saying they might never go back to as many people coming into their doors. This is helping them with transportation issues as well as access. So there are multiple ways that we are looking at mental health, but it's a key factor in just our well-being and how we're doing during this time.
Thank you. Dr. Graham, did you want to add anything on?
Yeah, you know, one of the things we have to be also careful about is mental health that doesn't present as mental health problems. So there's going to be, and especially with young children, you know, there's a guy by the name of Dr. John Rich, who's a mentor of mine, who did some amazing research about the cycle of PTSD in African-American men, particularly in urban communities, who see things that people see in wars, that people see in Iraq, and, you know, trauma like that. Internalize it and then act out in a different way. And they may not come to you and say, I'm depressed and I'm sad, but there's different kinds of ways in which they present in a clinical and a non-clinical way. Right now, we may have a generation that is witnessing and undergoing and seeing things. You know, they may be seeing a family member, particularly within our communities, who's in the house suffering, not able to socially isolate. And then in many cases, who knows how that clinical outcome might turn out. There's a lot of things that are happening now. I think what we have to be particularly mindful of now is undiagnosed mental illness, how we prepare a primary care system using the technologies. And I do want to keep emphasizing this idea that, that we are technologically advanced, where we should be able to use a lot of the things that are burgeoning around artificial intelligence and bring them into low-income communities, and understand what are some of those clinical, non-clinical signs that we can pick up on to look at what makes, what would lead to the early diagnosis of mental health problems. But I do think that is of the top of the list, but we need to understand that it may not be where people come in and say, I'm feeling sad today.
Another great question that we just got in is on poverty. And so addressing some of the reasons why Black and Brown people have lagged in escaping poverty, as that is in fact a key driver on how COVID-19 presents and the disproportionate impact it's having. Mayor Scott, do you have some comment just based on what you're seeing in Little Rock and in Arkansas?
Yes, from a poverty standpoint, I think we can all agree that access to quality and affordable education is very critical to fighting against poverty. And one of the things that we've been focused on here in Little Rock is how do we provide funding for early childhood education early on, particularly from 0 to 5 areas. And so we've really looked at that data and are pursuing potential funding opportunities to provide, no matter which school district that you are part of here in the city of Little Rock. We have 2 school districts. As long as you're a Little Rock resident, we're pursuing funding to provide that type of early childhood education. So we're on that journey right now and really lock in step as seeing that as a true issue and public policy forum to really eradicate poverty. Secondly, moving from the early childhood education, we have to take care of the existing pipeline of our workforce, particularly within the ages of 18 to 35, and really focusing on how particularly our brothers and sisters that did not do traditional college and things of that nature, but to really increase the number of entrepreneurs that we have in our city to really create a jobs ministry. And by doing that is really having accurate and quality apprenticeship programming first. And so as we kind of connect those dots of early childhood education and really focus on that 18 to 35 pipeline that didn't do the traditional 4-year college. And as we're seeing right now more than ever, is that we have to really focus on technology and innovation because it's better to be a software developer than it is to be a banker. And it's better to be a software developer than it is to be an engineer at these standpoints right now. And so really thinking about the new economy that has already arisen, but is continuing to evolve and develop.
One other thing I just thought of as you were talking was going back to Dr. Graham about trauma. Your question was about legislators as well. And our state, under the leadership of our governor and legislature, have also focused on creating trauma-informed care, like training across the board, from schools to police to all kind of folks. Because as Dr. Graham said, sometimes it doesn't present as obvious as you would think. But I also want to talk about sort of the training and cultural competency and things for the providers who provide the care. Because, you know, even as we're talking about what are these disparities, sometimes it isn't poverty. Sometimes it is just that implicit bias or, you know, and so the situation like the opioid epidemic, it was interesting. We have a bipartisan task force in Congress. And initially I was the only African-American on the task force because people didn't see that as a Black issue or a issue of color. Plus, I represent a whole state, so and it's, you know, primarily not Black. But what I noticed is that initially the reason why African Americans weren't thought of as part of it was because people weren't listening to our pain and then prescribing opioids. And so it didn't start there, but it has shifted there. And we've seen numbers to say that. And I think part of that is people want to be heard. People also need to know how to advocate for themselves. And, you know, we've been talking about maternal mortality as well, and just the outrageous numbers there. And we had a person testify in our committee who said a mother of a young Black woman who died, who was a health educator. She was a health educator. She was afraid to speak up too much because she didn't want to be thought of as an angry Black woman. Mm. Again, it's also about the care, who gives the care, how we are educating people who are in the health system as well. So, and that's both mental health as well as physical health.
Akunna, I just want to make one last point on this because Representative made me want to go back to something. You know, the National Medical Association of Black Nurses, the National Medical Association is one of our partners in outreaching from CVS Health. We're doing this campaign to try to make folks aware of where testing sites are and connect folks in the African-American Hispanic community tested. But what the point I was going to try to make is, you know, we have to understand the importance of those institutions. Times like this highlights how, and the data is backed. There's a lot of folks of Alex Green, Joe Benker, a lot of folks have published on how concordance within communities improves the messaging in terms of having more African-American and Hispanic, Asian American and Native American clinicians, whether it be nurses, doctors, or PAs or whatever, and how those reach into communities. We saw from various epidemics that the messenger is important. And so from our standpoint, partnering with the right community, the right organizations to get the message important. But if we take back and think of it as a country, we need to understand the importance of those organizations, both before times like these and during times like these.
Thank you. And that brings up another question we just got in terms of equal access to treatment and testing. How do we ensure that that there is equal access to any treatment or vaccine that's developed, so that we don't have the same issues we're seeing with access to testing now for minority communities? And Dr. Graham, I know that you've been focused on testing in minority communities, so talk about that, and then equal access to treatment.
Yeah, so one of the things we did from CVS Health is we had a specific campaign reaching out to minority communities to try to connect them to testing. In addition, making sure that some of the sites where we have testing, like the ones we have in Georgia, are connected to urban communities and being able to make that connection, and also educating people. It's interesting. There's so much information right now that sometimes it's too much and it almost comes out across as too little in our communities. Once we were doing a lot of the outreach around testing and understanding what people are thinking locally, there's a lot of misinformation out there. You'd be surprised about what people think and thought this epidemic was about. And so for us, testing is important, connecting people to testing, collecting the data around testing so that we can retrospectively look at how impactful our outreach has been, but also understanding the messages and the messenger. That's Public Health 101 in terms of community outreach. But for us, partnering with, again, the Black doctors and the folks who are in communities was particularly important.
Thank you. Mayor, we have a question for you, focused on how your local business and community leaders are responding to the crisis, what they're calling for, particularly because we know that there are so many problems, whether it's access to food, issues paying for housing and utilities. What are some of the things that are top of mind for your constituents?
Well, I would say right now, in this era of many of our children that are at home with their parents or lack thereof, is really access to food, access to public Wi-Fi, because many times we have our children that are now dealing with virtual education, but they may not have broadband access. They may not have the ability to afford an internet plan of that sort. And so it's incumbent upon we as city leaders to figure out how can we stand in the gap in these areas. And many times it disproportionately affects Black and brown communities. As a matter of fact, it's mostly Black and brown communities here in the city of Little Rock. And then going back to food insecurity, one of the things that we were able to do is really create public-private partnerships that once our children were sent home, we understood that many of our children, and the Little Rock School District is probably 70% Black. And so we knew that many of those children, the only 2 guaranteed meals they had was when they were in the school. And so we work with World Central Kitchen as well as the Clinton Foundation and other nonprofit organizations to really ensure that those children, our children, were able to have meals going forward. And so far, we've already provided close to 200,000 meals to our children here in the city of Little Rock. So it's food insecurity, it's true public Wi-Fi to help not only our children in the educational system, but also our entrepreneurs and small business persons as well, because as we're entering this new economy, is that technology and delivery and logistics is going to become more prevalent and important on how we deliver a service to the end user. And then one of the things that here in Arkansas, we have a very landlord-centric policy process that is to the end user, and the rental tenant is not very safe, and it's not a safety net. And so we're calling for figuring out how we can have a more renter user-friendly policy process from a statewide perspective. We're happy that many of our judges during the COVID-19 pandemic are not taking any cases as it relates to evictions. And so that's a way that they are standing in the gap for our citizens, and we're grateful from that standpoint. But then again, some of the most hard-hit residents in Little Rock are those that are truly unserved and underserved by what I would call the unbanked. Those entrepreneurs that really do not have a relationship with the bank, has never really wanted or truly understood the rationale for it. And so now in this process of really needing access to these payment protection program loans, we're really again starting to see the economic disparity. And so we go back, as I talk a little bit more about the economic disparities, because when you begin to have the economic disparities, because there's a healthcare disparity as well. You can't have a vibrant economy unless you have a sustainable and healthy workforce and a sustainable, healthy entrepreneur ecosystem. And so we're calling for what can we do to move things forward. And that's the reason why we go back to intentionality. We as policy leaders have to draw from our own, particularly Black and brown policy leaders, draw from our own experiences of growing up at the different plights in our own particular lives. And now that we are at these seats and we're at these tables, we have to be very intentional about the policies that we forward. So one of the other things, in addition to ensuring that we have meals for our children in these times and trying to figure out public Wi-Fi, we'll be announcing tomorrow a small business grant program through the work of many folks like like our congressman here today, because they have really allowed greater flexibility with our CBDG program. And so we're going to be issuing a number of different small business grants, not loans, but small business grants with a lot of greater flexibility from our CBDG programming. And so we're excited about that. And then two, I think one of the things that we're not speaking to, have not had the opportunity when we talk about disparities, is also the disparities of our homeless brothers and sisters.
Yes.
And they're really having a number of different impacts right now. So we're working with HUD, and this is also maybe definitely a shout out to our Congresswoman here today, to really figure out how we can get guidance out for the emergency solutions grants that are part of the HUD process, because the quicker we can do to ensure that our homeless brothers, who are really a part of a containment right now in their different shelters, but how do we figure out how can we get them into more creative solutions in housing and as we go through this journey?
Well, thank you. So we are just about out of time, but I wanted to end with you, Congresswoman, on a question that came in that I think is really important and touches on what the mayor just said, which is, how do we ensure that lawmakers are thinking about policy through a disparity lens? And what are some of the ways that we can address implicit bias as we think about some of the coronavirus response?
Well, first of all, as we are about to close, I want to thank you so much for the opportunity. I would just say, you know, many know that the Congressional Black Caucus is called the conscience of the Congress. And so, as I mentioned, there is a group, work group that is working to hold all of us accountable. Even the issue that the mayor just brought up in terms of the PPP loans and the fact that it was first come, first serve, and many unbanked or underbanked people didn't get in. We fought really hard to have a carve out of dollars that specifically were targeted there. But we also have the Hispanic Caucus. We also have the AAPI Caucus. We as a tri-caucus tried to work together. And I think it really is the responsibility of every single one of us. You know, I think what we're seeing on the news is what we already knew. It just shone a light on what existed. And as I said before, whether you do it from a moral perspective or a money perspective, either way, we need to deal with this. And I would just close by saying to anybody affected right now, our hearts and our prayers go out to you. My son, who's 33, every day he's texting me with somebody he knows whose family member or who has been affected. And so it is touching all of us. And there's an African proverb that says, sticks in a bundle are unbreakable. We need to come together so that we won't be broken.
Amen.
Thank you. Thank you for that. And thank you to Mayor Scott, Dr. Graham, and of course, Congressman Rochester for joining us today. And thank you to our audience for joining us for this important conversation. And I hope that everybody is staying safe and staying healthy, and we'll look forward to seeing you back tomorrow for tomorrow's conversation. Thank you.
Thank you.
Thanks.